Bismillahirrahmanirrahim. Assalamu alaikum. I'm Dr. Habib Rehman from CHS, and uh, and the topic for discussion today is regarding cancers related to head and neck. So, yes, we'll start with the learning objectives. Students, as I've mentioned in my last lecture as well, these learning objectives are basically the core topics that are provided by our governing university, JSMU, and these are the topics that are important even for examinations, not only in CHS-based examinations, but all the examinations. So we'll start with these. Uh, uh, the first objective is to describe the different types of head and neck cancers. Second one is to identify the risk factors associated with these cancers. And the third one is to explain the strategies for prevention, control, and management. As you all know that we are from CHS, Community Health Sciences. And the third point is very important in this regard to prevent and to control the illnesses and issues and to manage these. Now, going forward, uh, we will start with the anatomy of the head and neck. As you can all see that there is a oropharynx, and in the front, then we also have a soft palate, and oral cavity is there, and we can all understand that there is hard palate and of course tongues and lips. Now this is the anatomical presentation, and the cancers related to these of course are called the cancers of head and neck. Now starting with the names, head and neck cancers comprise of a diverse range of malignancies affecting anatomical regions, as we have discussed, from neck up, above the neck. Cancers according to the anatomical sites are oral cavity cancers, pharyngeal cancers. Based on pharyngeal cancer, there are three. That is nasopharyngeal going towards the nose, oropharyngeal going towards the oral cavity, and then hypopharyngeal cancers. And the third one is laryngeal cancers. Fourth one are the nasal cavity cancer, and the fifth one is paranasal cancers. Now, regarding the oral cavity cancer, these cancers occur in mouth and lips. They can develop on lips, tongues, gums, floor of the mouth, and the inner lining of the cheeks. Risk factors. The risk factors for these are tobacco use, both in the form of smoking and also chewing tobacco. That includes gutka, niswar, and of course alcohol consumption, HPV virus, human papilloma virus, infection, and poor oral hygiene. Regarding the pharyngeal cancers, this is the second one. Pharyngeal cancers occur in the throat. Uh, it's just adjacent to the oral cavity, and which includes tonsils and base of the tongue. They are further categorized into nasopharyngeal cancers located behind the nose, oropharyngeal cancers found in the middle part of the throat, and hypopharyngeal cancers occur in the lower part of the throat. Types of now the third one is the laryngeal cancer. Laryngeal, regarding larynx, these cancers affect the voice box, also known as larynx. They typically originate in the vocal cords. Larynx is a box where the vocal cords are located, and these are the two pairs that enable humans to speak and to produce sounds. Risk factors include smoking, alcohol consumption, exposure to workplace carcinogens, and chronic irritations of larynx. Now, the nasal cavities are cancers and paranasal sinus cancer. These cancers develop in the nasal cavity and paranasal sinuses, which are air-filled spaces around the nasal cavity. The risk factors for these are exposure to wood dust. Now, this is different than the previous risk factors. We have added wood dust, asbestos, which is now banned in many countries, but I think in many developing countries, it is still in vogue. and people are producing products from asbestos and certain chemicals, and of course, tobacco smoke. Histological. Now we have discussed these cancers according to the anatomical sites, but now we are discussing these cancers according to the histological types. Starting with the squamous cell carcinoma, the most common histological type of head and neck cancer arises from squamous cells lining and the mucosal surfaces of the head and neck. It is also associated with tobacco and alcohol use, as well as HPV infections in certain cases. The second one is adenocarcinoma. Now, this arises from the glandular cells in the head and neck region, less common than squamous cell carcinoma, but can occur in various sites, including salivary glands. Now, students, squamous cell carcinoma is by far the most common cancer of head and neck. And after that is adenocarcinoma. This is an important point, and you should also remember this. This can be a stamp in your MCQ. Um, Now, the third one is sarcoma, a rare type of cancer that develops from connective tissues such as muscle, bone, cartilage, or fat. Can occur in soft tissues of head and neck. The fourth one is melanoma from the melanocytes and the pigment producing cells. Can develop on the skin of the head and neck, including scalp, face, neck, as well as the mucous membranes, uh, that is inner lining of head and neck. Treatment of these cancers include options depending on the type of and stage, location of the cancer, and may include surgery, radiation therapy, chemotherapy, targeted therapy, and even immunotherapy. Now you can see the first one is the first stage. Now the cells have started growing, and in the second stage, there is engorgement, and even the blood vessels have increased, supporting the carcinoma to grow. Regarding the risk factors, now this is the second objectives, and the risk factors that can end the life of certain people. These are the commonly used things usually. Starting with the tobacco use, smoking and smokeless tobacco significantly increases head and neck cancer risk. Tobacco contains carcinogens, damaging mouth, throat, and head tissue. Smoking cigarettes, cigars, pipes, or chewing tobacco heightens the risk. And of course, we can also see that there are other forms of smoking that include vape and e-cigarettes that are equally dangerous and should not be an alternate to the traditional cigarettes or cigars. Second risk factor is alcohol consumption. Heavy drinking, especially with tobacco, raises the cancer risk. Alcohol acts as a solvent, enhancing the carcinogen absorption. As you can all understand, that alcohol actually dissolves as a solvent, uh, and and the carcinogens are then absorbed more rapidly. And if a person is smoking and he's also drinking, now this is the most dangerous thing. And usually both these ill habits are coupled with each other. Combined, very dangerous and multiplies the cancerous many folds. HPV infections, usually HPV 16 and HPV 18, increase the oropharyngeal cancer risk transmitted through sexual contact in infecting mouth and throat. Um, Sexual contact is usually oral sexual contact, and HPV positive cancers often occur at a younger age and have better outcomes. Of course, at younger ages, people are more sexually active, and this is the good thing is that in younger ages, they have better prognosis in this regard. This is a picture of human papilloma virus. And it is very dangerous and is transmitted sexually. Now, regarding just an additional point about BPA, and this is a synthetic estrogen, and it has been found in common products like plastics and dental sealants, thermal receipts, consumer products like CDs, and even the bottles that are used for feeding children. So you must have uh, observed that now there are feeding bottles that are specifically made and mentioned that those bottles are BPA free. Now, what does this BPA do? BPA acts as an external synthetic estrogen and can cause estrogen related carcinomas in humans. And of course, and it is a very dangerous risk factor and can even cause cancers of head and neck. Because if the alcohol consumption is used with these carcinogens. Now, this can increase the risk of absorption of these carcinogens that includes BPA. Now, the fifth risk factor is the neglected dental care and chronic inflammation. Poor oral hygiene leads to bacterial buildup and chronic irritation, gums disease, and oral thrush may further increase. Other risk factors include genetic predisposition, risk age, that is the age. This increases with age, typically diagnosed after 50. Gender men are more susceptible with ratio of 3 to 1. Immunosystem suppression. Conditions like HIV or organ transplant meds raise the cancer risk due to weakened, weakened immune systems. Uh, Now, the third objective, it is about prevention and control of head and neck cancers. We'll start with primary prevention strategy. That is, of course, tobacco cessation program offers free smoking cessation counseling sessions at local community centers, and even in many governments, particularly in Turkey and in West, they've increased taxes on cigarettes, and now people are forced to decrease or to quit cigarettes because it is getting expensive. But unfortunately, the advent of vaping culture is a new threat and should not be supported. Whenever somebody passes you a fag, you should say, no, brother, I don't smoke. I won't smoke. I don't want to smoke. And if you are already smoking, you should think about quitting. It's not about head and neck cancers. It is very dangerous and can even causes cancers not to you, but if you are or anyone is engaged in smoking, they can also cause harm to the second-hand smokers. So this is dangerous. Of course, alcohol moderation. Of course, as we do not we do not promote or support alcohol moderation, but we say that we should not consume alcohol at any level. But according to the international standards, they say that alcohol should be used in moderation, and they say to organize educational workshops in the schools to raise awareness about risk of excessive alcohol consumption. And of course, HPV vaccination can be a solution, and collaborate with healthcare providers to host HPV vaccination clinics in community centers, promotion of healthy lifestyles, distribute educational materials on balanced diets and oral hygiene at health fairs and events. Can HPV be prevented? You can reduce your risk if you use or get an HPV vaccine. Every young girl should be given the vaccine, and of course, those who are sexually active, they should use safe sex practice, and of course, should be responsible and protect one's own partner. and of course get screened and tested regularly. Regarding the dental issues, early detection, conduct free oral cancer screening on local health clinics, dental clinics to detect abnormalities early, and ENTs also work on this, ear, nose, and throat doctors, and also one should also be provided skills for self-examination guides and encourage monthly self-checks for individuals at high risk. What does that mean? If a person who is taking the risk factors, alcohol, or he is actually active, or he is smoking, those individuals should be obliged to do self-examination. 8 steps of oral cancer screening. Treatment options. This is not the primary prevention, but it is the secondary prevention, and that includes the treatment options and supportive care. In options, one offers a multidisciplinary approach, including surgery, radiotherapy, radiation therapy, chemotherapy at specialized cancer treatment centers, providing information sessions for patients and families on treatment options and potential side effects. Supportive care includes offer rehabilitation services such as speech therapy and following exercises for patients post-treatment. Provide counseling and support groups to address emotional and psychological needs during and after treatments. Now that's all, folks, for today. Thank you for listening and best of luck in exams and also future endeavors.